Family-centered care in the Neonatal Intensive Care Unit. Nancy Siegel, a professor at California State University, wrote an article that discussed a neonate named Ramesha Raman, who was born at 26 weeks gestation and weighed in at only 8.6 ounces. This is the lowest weight on record of a surviving neonate. For comparison, a regular 250 milliliter can of soda is equal to 8.5 ounces. Being only 0.1 milliliter heavier, Ramesha had the fight of her life ahead of her, and she did all of her fighting in the Neonatal Intensive Care Unit. This record-breaking case is only one of millions that have occurred in the specialty unit to provide life-saving care to infants who are at the most vulnerable point in their existence. The Neonatal Intensive Care Unit was created as its own specialty unit in 1922, and in the last century every piece of the program has evolved. There have been many innovations in the technology that are used to care for the infants. For example, doctors are able to monitor vitals by just a sensor on a tiny finger. Techniques of care have also altered in the sense that parents used to only be able to interact with their premature baby through a glass wall that separated them. Now, parents are being encouraged to provide care in the form of treatment. Family-centered care is emerging as a trend in the neonatal intensive care unit that is allowing for parents to aid in the rehabilitation of their own children. Neonatal intensive care units play a major role in the life of newborn babies who are in need of external support in order to sustain life. External support is given to these babies by machines such as ventilators, continuous positive airway pressure or CPAP devices, and nasal cannula machines. These are some of the most commonly used supports for transportation of oxygen through a baby's lungs when they are not developed enough to breathe themselves. Vitals are maintained by sensors that are placed on different locations on a baby's body in order to track heartbeat, blood pressure, and temperature. Babies are kept in incubators, which are safe environments that control the temperature, oxygen, and CO2 levels in order to keep the baby's internal environment within normal limits. In cases such as these, the child is attached to many monitors, making it hard for the parents to interact with their own infant. However, in the decades before modern technology, parents were only able to view their babies from a significant distance. In the beginning of the NICU as its own specialty, there was no interaction between parents and neonates because it was believed that there was too high of a chance of transmission of disease. Parents were forced to only view their babies from behind a glass wall that separated them. This idea has gave way to a new trend that allowed for parents to be the provider of care for their own neonate. Family-centered care is believed to be able to control the heart rate and blood pressure of the child just by being in contact with the parent's skin near the location of their parent's heart. Skin-to-skin contact has always been suggested, but just for the sole purpose of providing a stronger bond between mother and baby. The research article Effect of Kangaroo Care on Physiological Parameters of Low Birth Weight Neonates in Selected Hospital of Bhatteswar, Odisha, described the contact as a non-controversial, low-cost method of newborn care that provides warmth, touch, and security to the newborn and is believed to confer significant survival benefits. Research is being conducted all over the world on the positive effects that this contact has, and is proving to be beneficial to the mother and the neonate. With premature babies being born every day, it is important that there are resources available for them that allows for the best chance of survival, and those resources are the Neonatal Intensive Care Unit and the technology that is used to fill it. Research is being conducted around the world in order to provide results that support the claim of Kangaroo Care and the effects that it is having on neonates' health. Advancements are being made already in the techniques that are practiced, trying to provide the most positive results in the infant's health. A study was conducted in Finland in 2009 that compared the impact of Kangaroo Care and Kangaroo Care paired with music therapy. Music therapy used in the trial was played on a string instrument and paired with a female vocalist voice. The effects were evident on both mother and baby. Results presented in the trial were shown in the pulse, the respiration, the oxygen saturation, the blood pressure, and the growth. When data was presented, the following was observed. Pulse decreased significantly towards the end of the session. Oxygen saturation increased towards the later sessions. The mean increase of the infant's weight was 27.6 grams per day. Once this technique is performed over the course of a neonate stay in the NICU, the sympathetic nervous system is able to pick up on the changes that are being made and adapt to make the changes during dual therapy and normal function of the body. Baby is born and is not at full term, their organs are still in the developmental stages of growth that the infant would be in if they were still in the womb continuing to grow to term. Underdeveloped organs or body systems leave the baby in a state that is vulnerable to infection or disease, limiting the capacity of interaction that they can endure. It is important that while in these states of vulnerability, that the people caring for them are well equipped with the knowledge and experience to sustain the fragile life that is in their hands. While the infants are the main priority of the nurses, they also have to be conscious of the parents that are involved in the unit as well. Parents are just as much of a patient in the NICU as the infant is, and nurses have to relay the information to the parents concerning the care that is going to be given to their child. Environments with stressful surroundings induce more stress, and the neonates are able to sense that when they are cared for. High levels of stress cause a hindrance in the maturation of organs and body systems that the infant is trying to develop, so it is important for the nurses to eliminate external stressors that the parents may have. Neonatal intensive care units save thousands of lives a year just by providing quality care to the tiniest of patients. Ramesh Raman is just one case of millions that have occurred over the almost 100 years that the specialty unit has been around. If Ramesh could be saved at such a low weight, nearly 10 weeks before her actual due date, and still be brought to a stable condition which allowed her to sustain life on her own, then endless possibilities for other premature babies are to come.